like to start off and talk about, have the patients tell a brief thing of their story about when they were told they had myeloma, how they reacted to cancer, treatment they got, where are they now, and how has it affected the family.
I lived in a shack in the town of Berlin. It was 750 square feet. And I told my wife when I bought the house, we're only going to live in it for a year and I'll build another house. Well, 5 years later, I finally put the house up. And when we moved into it, the same time I was diagnosed with multiple myeloma. That was 2001. The doctors that I had seen, the first two doctors I saw, I got a first opinion and a second opinion, and they were both the same, that I needed a bone marrow transplant. They didn't talk about stem cell transplants back then, it was bone marrow. And then I was going to be out of work for about a year, in the hospital for 2 to 3 months. I said, I don't know. And they said, and you should be able to get 5 years out of that. I said, well, 5 years, I got 2. I'm going to lose a year, and you're going to give me 2 more. I'm only getting 2 extra years. I don't think I want to go through that. So I went for a third opinion to Dana-Farber. And there we tried some steroids, and it brought my numbers down. And he said, well, we ought to think about a transplant. I said, I came here because I didn't want a transplant. So I got into an experimental trial, and within 3 months, I was in remission. And I sat down with Paul Richardson, who's not my doctor, but he was seeing me that day. And he said to the nurse, he says, I think we have a CR. And I said, oh. And so I told my wife, I said, he said, I'm in complete remission. Well, I found out afterwards he meant complete response. But I like my definition better, and I'm going to stick to it. And I've been taking the pill ever since. And I'm down to only 5 milligrams now. 3 weeks on, 1 week off. As I said a little earlier, I had just started a business. There was 4 of us working there. Now I have 12 employees. We have our house that we'd moved into, and I decided I was going to go play around, and I went and played. I bought a new Corvette, and I went to Italy and had some fun. And then I realized I'm going to live. If there's anything that I would have liked to know then that I know now, is that I was going to be here now.
I was diagnosed when I was 39 years old in November of 2008. Earlier in spring of 2008, I started developing random bone pain in my ribs. And at the time, my husband and I were doing a lot of rock climbing. So the doctor naturally thought it was a sports injury. And tendonitis, costochondritis, told me take some Advil, rest. 6 months later, I was diagnosed with myeloma because I researched my symptoms online and asked my doctor for a blood test. Could it be this, whatever this is, myeloma? Oh no, you're too young. Sure enough, I was diagnosed with myeloma. Immediately started treatment with Revlimid and dexamethasone. So thank you to all the cancer organizations, MMRF, LLS, all the drug companies, Celgene. It's because of them that those drugs were available to me when I was first diagnosed. Induction therapy then started, Revlimid, dexamethasone, Velcade. Did a stem cell transplant at City of Hope. In 2009, I got a near complete response, which means close but no cigar, and did continuing treatment on Revlimid for 2.5 years, which kept me very stable. My myeloma expresses the kappa light chain proteins. At diagnosis, those levels were at 3,000. Before transplant, they were at 600, and post-transplant at 60. The Revlimid kept me stable for 2.5 years at 60, and then it stopped working, so I started taking pomalidomide, and that's what I'm on now. The numbers, they'll go up, they'll be stable, they'll go up, stable. So right now I'm hovering around 400 for my kappa light chain proteins, and I'm just thankful to everyone for all the help.
I was diagnosed in September of 2010. I went in for basically to get an approval for cataract surgery, and my nurse practitioner, who is my primary care person, said, after she looked at my blood workup, she said, "You're approved for this, but you need to come back. We need to run some other tests." What she'd noticed is that my total protein was slightly higher than the highest of the range. So we ran some additional tests. She basically called me back in and told me that I had myeloma. Like most patients with multiple myeloma, I'd never heard about the disease before. And she told me something that I thought was very wise, which was that I should not look up this disease on the internet. And I did not. However, my wife, who's my primary caregiver, did, and she became very, very concerned. So at that time, I was being seen by a local oncologist, and I requested a second opinion, got one at UCSF, and am now currently in treatment there. So I presented as a smoldering patient, and with no Crab's symptoms, and eventually in about 18 months to 2 years progressed to full-blown myeloma. I've been on RVD for induction, and that went on for, I think, about 11 cycles. I did stem cell collection in between, and then I've been on maintenance for approximately, I guess, about a year and a half now. I'm scheduled for a stem cell transplant either the first or second quarter of this coming year. I had a very good partial response. My numbers are down. My M-spike's at about 0.2, and my IgG is about 650. Kappa light chain, and I'm a kappa light chain, and excuse me, and the kappa light chain is approximately 10. So I'm well within the bounds of a normal set of numbers. And at this point, my maintenance therapy consists of 5 milligrams of Revlimid and Velcade every other week.
My name's Diane Barter. Very happy to have my wonderful husband still here with us. When he was first diagnosed, we had still young children. I had my oldest son, well, we have 6 children together. Together we have 3 sons, so I have 3 stepdaughters also. But our oldest son was about ready to go to college. That was really hard for him. So just as a caregiver, I was worried about my husband, worried about how are my children going to be? Is he going to be able to work? What's going to happen? There was a lot of stuff going on. But I think the one thing there's a lot of things that helped. But Terry has an amazing attitude. He's like, okay, it's just something I have to do. We're going to beat this. And back when he was diagnosed, there was nothing like there is now for treatments. That was the transplant. That was about it. So I'm really thankful for all the doctors and the researchers. The value is we have our life. And he didn't say to you, yes, we went to Italy. He bought a Corvette. And then when he was doing well, we sold that because we had all these kids going to college now. And we had to work. I went back to work. But he also now, he said to me when he sold that Corvette, he said, I'm going to get another one someday. And now he has a brand new one that is pretty awesome. 2014 Stingray Style C7. It's awesome. So, he still is living life to the fullest. And as far as a caregiver, there are some challenges. Like I said, he was diagnosed when our children were still young, so dealing with them and having the help of our community, like it takes the whole community to raise a child. The people in the community, they're really there to help. So teachers that my kids had were an extra person for them to go to. There's just a lot that you can find. And I really think the attitude helps, because I was really scared, but he wasn't. At least he didn't act like he was. So that's a great attitude, is really helpful.